Hey everybody! So in this video, we are going to talk about medical procedures or dental procedures and DID. Now, for a lot of people with DID, though not all, medical and dental procedures can be very triggering. They can be really difficult to deal with, and for some people can even be traumatic. So we're going to cover some of the basics on how we handle these different kinds of procedures and some different tips for anybody else out there with DID or who's supporting someone with DID on how to deal with these things. So, when we go to the doctor and we know that we're going to have to be examined, we always make sure to reassure any members of our system who are feeling more apprehensive about being touched or experiencing these examinations, because we really don't want to have some little be triggered out and be scared and vulnerable and maybe not in a good place mentally. It just causes a lot of trouble for them, it can cause them a lot of pain and suffering, and it makes things a lot more difficult for us with getting proper medical treatment when we need it. So we tend to do a lot of grounding exercises. That's ways to help stay present and stay the one in control of the body. We tend to do a lot of deep breathing. And if anybody is uncomfortable, we comfort them and talk to them and do our best to reassure them that everything is okay and that we're safe. Now, this becomes a lot harder if the medical procedure that you're talking about is a bit more invasive. For female people, gynecological exams, or male people, prostate exams, that can feel really, really invasive and uncomfortable and can be a huge trigger, especially to members of the system who hold trauma, if your trauma had any sort of physical or sexual basis. In our case, those kinds of exams are very triggering. It's not good. It's just not. So what we've learned to do is have some of the protectors on standby so that if a switch occurs, they're the ones coming out and not a very traumatized little, for instance. That way, they make sure that they can keep our system safe, keep the littles safe, and make sure that the medical procedure can still go through as planned without any problems. Now, for dental visits, these can be especially triggering for littles in the system because there's a lot of scary sounds, a lot of sharp, pokey instruments, and let's be honest, sometimes dental procedures are painful. Getting Novocaine shots in your mouth, even just getting your teeth cleaned when they scrape them can hurt. And as the host, for me, it can be difficult when I'm sitting there and say, we're getting a teeth cleaning and I'm experiencing a fair amount of discomfort because it's painful, and I've got protectors going, stop that hurts, and I'm not okay with it, and I'm having to be like, it's okay, you don't need to protect us, they're not trying to hurt us, it's not on purpose, this isn't a life or death situation, you don't need to do that. Now, thankfully, because we've been in therapy for a good long while and we've built good communication, a lot of times I don't have that problem anymore where I'm having to continuously reassure everyone mentally that everything is okay and that nothing bad is happening, because now that we're much better at being co-conscious, meaning that I'm not the only one aware of what's going on, they can see what's happening and they realize that we're not in danger. But that doesn't mean that it's not still difficult, and it doesn't mean that sometimes dissociation doesn't still happen. So when it happens, we have some things in place to help make sure everything stays safe. And the first one is, if a little is the one to switch out, immediately an adult or protector member of the system will either become co-conscious with them or switch with them to keep them safe and to keep them from being potentially re-traumatized by an experience that is scary and that they don't really understand. And this has worked really well for us for a really long time, but we understand that a lot of people out there with DID don't necessarily have the kind of co-consciousness and communication that we have, because we've only achieved that through over 6 years of continuous DID therapy. It's not something that just happened overnight. So for people who don't have that kind of internal communication, we recommend keeping a journal, letting everybody know what's going on, talking inside your head about what's happening, what the person is doing, that you're safe, that the situation is not dangerous, things like that to help keep everybody okay. Also, if you have a particular comfort object that members of your system particularly like, especially littles, like a small stuffed animal, even if it's just a keychain, that can be really helpful to help keep you grounded and help keep them feeling safe. And for people who don't have DID, if you're trying to support someone who does through a medical procedure or a dental procedure, hold their hand gently if they're okay with that, and remind them where they are, what's going on, what day it is, what year it is, that they're safe and that you're there and that everything is going to be all right. Just keep them aware of the fact that you're there for them, that you're not going to leave, and that they're safe. And that can go a huge, huge way in helping people with DID cope with an otherwise incredibly stressful environment. Because let's be honest, who doesn't find it a little stressful to go to the doctor or go to the dentist? I don't really know many people who enjoy it. So it can be a huge load off when you have someone there to support you. Now, if you're alone and you don't have that option, then again, the grounding techniques, the positive self-talk, telling yourself this is okay, I'm safe, can make a huge difference in how well you will cope. Now, we have had some situations where littles have switched out and been the one dealing with a medical procedure, and that was not good at all. They got really scared, started to cry, and, the doctors didn't really know what was going on, and they didn't know what was happening. We didn't really know what was happening either, because I come back and I have no idea what's going on. So it was all very scary and very not fun. But that's why building these toolkits of different coping strategies is so important for people with DID, because you don't want to be triggered in a situation like that where you're vulnerable and where it could potentially traumatize other system members. So just remember, if you have DID or you're supporting someone with DID, build as many positive coping strategies as you can. Whatever works for you and is healthy, do that. Okay? Keep yourself feeling safe. Let everyone in the system know that you're safe and that everything is going to be all right, and that even if something might be a little bit painful, that it's part of a necessary treatment and no one is trying to hurt you. So I really hope you enjoyed this video. If you did, please hit that like button, subscribe, and don't forget to hit that notification bell. And we all really want to thank all of our wonderful subscribers and commenters. You all mean so much to all of us, and we really appreciate all of your wonderful support. Have a good day, everybody.